Septic arthritis is clinically defined as the infection that occurs within the body of an individual. It can be a very painful condition that can cause detrimental effects to the joints if not treated quickly and thoroughly. Within this case, we are examining an 83-year-old male brought in by ambulance from the GP after suffering dizziness whilst being examined. He presented with increasing discomfort and a painful, swollen right knee. Whilst examining, we are also able to determine other symptoms he is experiencing, inclusive of his right knee being hot, red, painful, and swollen. His pain score out of 10 being an 8. Limited range of motion within his right knee. Temperature of 38.7 degrees Celsius. Elevated respiratory rate of 22 breaths per minute. Blood pressure reading of 90/50. An elevated heart rate of 120 beats per minute, and deformities of the joints and wrists of both hands. Therefore, a diagnosis has transpired to be septic arthritis present within the right knee joint of John. Septic arthritis is an infection within the joint of an individual that can be caused by an infectious etiology inclusive of bacterial, viral, fungal, or other pathogens that has travelled through the blood to the joint. Moreover, septic arthritis may be caused by a direct injury or puncture wounds delivering infectious agents directly into the joint. Septic arthritis occurs when there is pathogen invasion of the synovium and joint space, which initiates an inflammatory response to occur. Risk factors that make an individual more susceptible to acquiring septic arthritis include degenerative joint disease, rheumatoid arthritis, corticosteroid therapy, existing joint problems including gout, lupus, previous joint surgery and injury, and medications as they may be immune suppressors. Although all are risk factors, the most common three that add to the commencement of septic arthritis are the degenerative joint disease, rheumatoid arthritis, and the corticosteroid therapy. Septic arthritis usually presents with symptoms of joint pain, fever, swelling, and reluctance to move the affected joint in fear of pain and irritability. Other signs and symptoms include fever, chills, joint pain that worsens with movement, swelling of the affected joint, redness around the joint, stiffness, warmth around the joint, fatigue, weakness, decreased appetite, rapid heart rate, and growing irritability. John is experiencing various symptoms on admission to the hospital that have been associated with a provisional diagnosis of septic arthritis. John's symptoms include deformities of the wrist. Deformities of the wrist is a clinical manifestation that he has presented with. Deformities of the wrist can be explained by his clinical diagnosis of rheumatoid arthritis and is not necessarily linked as being a symptom of his septic arthritis. John has rheumatoid arthritis in his history since the age of 18 and henceforth has had it for a total of 65 years. The rheumatoid arthritis could have made John more susceptible and at a higher risk of developing the septic arthritis that is present within his right knee, however, is not the result of the septic arthritis itself. John consequently is experiencing his right knee to be hot, swollen, painful, and has redness discoloration to it. Therefore, septic arthritis causes extreme discomfort and difficulty using the affected joint to the inflammatory response being initiated. The redness, warmth, swelling, and pain are indicating the vascular and inflammatory cell response in retaliation of the pathogens that have spread into the synovium and joint of John's right knee. Vascular permeability changes, leukocyte recruitment, and accumulation of inflammatory media release are processes that occur when harmful stimuli is detected within the body. The increased blood flow to boost white blood cell and nutrient transportation causes the area to become red and warm. Additionally, some of the chemicals produced within this process can cause fluid to leak into the surrounding tissue, which effectively initiates the swelling that John is experiencing, and henceforth this process as a whole may trigger the nerves and cause the pain that John is now experiencing. John, furthermore, on examination, is presenting with a low-grade fever of 38.7 degrees Celsius. Optimal temperature ranges are considered between 36 to 37 degrees, whilst John is consequently being recorded as febrile and having or showing the clinical signs of a fever or temperature. This is indicative that John has an infection or illness and is showing that the body is working to fight the bacterial, viral, or infection. By elevating the body's temperature through pyrogens binding to the hypothalamus located within the brain, body temperature rises to effectively inhibit bacterial growth. Henceforth, John's macrophages, monocytes, and T cells have detected the harmful stimuli within the body that have provoked the body to induct a fever to decrease or stop the growth. John has also presented with an elevated respiratory rate. Although John's respiratory rate is elevated, it is not overly high and can be explained due to his low blood pressure, and henceforth is trying to constitute for the body receiving less oxygenation by taking more breaths to increase the oxygenation within his body. The organs are depleted of oxygen and therefore he is taking more breaths to compensate. John is experiencing low blood pressure with a reading of 90/50 on admission after being brought in by ambulance. The inflammatory response that has taken place within the body as a result of his infection of the joint has caused vasodilation of the blood vessels. This is due to the cytokines that dilate the blood vessels to compensate for T and B cells to be transported throughout the body to fight infection. Hypertension therefore occurs due to the widening of the blood vessels and the ability of pressure to be able to be up against the vessel walls. Therefore, as his vessels have dilated, there is not enough pressure to give a high reading. Lastly, John is experiencing some tachycardia with 120 beats per minute as a clinical manifestation of his septic arthritis. It can be either the cause of John's low blood pressure or fever or both. An individual's heartbeat is controlled by the sinus node, which is the body's natural pacemaker that produces the electricity required to make the heart beat. The electricity of the heart helps to pump blood from the atria to the ventricles and consequently out of the heart and either to the lungs for reoxygenation or to the rest of the body to oxygenate. Due to John's low blood pressure, the heart works to pump extra blood around the body and by doing so increase the heart rate as it is beating extra to compensate. These are the references used within my assignment.